Imagine slowly losing the memories that define who you are and the ability to think clearly. This terrifying reality is the silent, ongoing threat of Alzheimer's disease. It is the leading cause of dementia and a medical crisis affecting millions of families across the US and Canada. In this comprehensive 3D medical animation, we take you inside the brain to reveal the exact biological mechanisms of neurodegeneration and explain the crucial difference between normal aging and the destructive progression of Alzheimer's. Early cognitive decline is not limited to simple forgetfulness. It includes difficulties with language, visual spatial awareness, logical thinking, and complex decision-making. Alzheimer's is marked by progressive brain atrophy, a shrinking of critical brain regions over time. Recognizing these initial symptoms is the first step toward timely diagnosis and intervention. The core of this devastating disease lies in two toxic proteins, amyloid plaques and tau tangles. Amyloid plaques accumulate outside neurons, forming sticky clumps that disrupt communication between brain cells. At the same time, tau tangles develop inside neurons, destroying the internal transport system and ultimately leading to irreversible cell death. The combined buildup of these protein pathologies drives the progressive nature of dementia and severe cognitive impairment. Early diagnosis is improving rapidly. Techniques such as spinal fluid biomarker testing and advanced PET scans allow clinicians to visualize amyloid plaques in the living brain. Current treatment strategies include medications that manage cognitive decline and new drugs designed to reduce amyloid accumulation itself. Understanding the latest Alzheimer's clinical trials is crucial for patients and caregivers seeking clarity. Although genetics influence risk, lifestyle remains a powerful tool for prevention. Building cognitive reserve through proper nutrition, regular physical activity, and mentally challenging tasks significantly lowers the risk of late-onset Alzheimer's. Managing diabetes, high blood pressure, and high cholesterol has a major impact on brain health. Awareness and early action remain the strongest form of protection. We have explored the main pathology of amyloid and tau, but the story of neurodegeneration is more complex. Recent research highlights chronic inflammation within the brain as a major accelerant. Microglia, the brain's immune cells, normally clear excess amyloid. When they become overwhelmed, they shift into a hyperactive state, causing inflammation that damages synapses and speeds up brain atrophy. This inflammatory process explains why systemic health issues can dramatically increase Alzheimer's risk. Vascular health is another critical factor. Vascular dementia, the second most common form of dementia, often coexists with Alzheimer's. Conditions such as high blood pressure, diabetes, and high cholesterol damage the brain's blood vessels, trigger microstrokes, and reduce oxygen supply to neural tissue. Maintaining cardiovascular health is one of the most important actions for Alzheimer's prevention because the health of the heart directly determines the health of the brain. Genetics also plays a role. The APOE4 gene is the strongest known genetic risk factor. Inheriting one or two copies increases the lifetime risk of developing Alzheimer's and accelerates amyloid plaque deposition. However, genetics is not destiny. Lifestyle interventions remain powerful even for those at high genetic risk. The true weight of Alzheimer's disease lies in its profound societal impact. Beyond the cognitive decline of the patient, the emotional and financial toll on family caregivers is immense. Our analysis confirms that caregiving for a loved one with progressive dementia is often a full-time commitment, demanding significant economic and psychological resources. Understanding the support systems available, from respite care to specialized long-term care facilities, is a critical component of navigating this neurological disorder in the US and Canada. The massive economic burden placed on healthcare systems highlights the global urgency of finding effective prevention and treatment strategies. To truly empower individuals, we must explore detailed, actionable Alzheimer's prevention protocols. While we stressed general exercise, specialized studies now focus on specific lifestyle interventions.
The MIND diet, a hybrid of the Mediterranean and DASH diets, emphasizes berries and leafy green vegetables, showing significant promise in delaying the onset of neurodegeneration. Our visuals showcase the brain benefits derived from sustained aerobic exercise, which increases blood flow and neuroplasticity, essentially building your cognitive reserve. We must also highlight the importance of challenging the brain through complex cognitive activities, such as learning a new language or mastering a musical instrument, which strengthens neural pathways and provides resilience against the structural damage caused by amyloid plaques. Furthermore, research into the earliest preclinical stages of Alzheimer's disease is paramount. Scientists are aggressively working to identify reliable, non-invasive biomarkers that can predict risk decades before the onset of overt memory loss. Current clinical trials are exploring novel approaches, including vaccines targeting tau proteins and deep brain stimulation, moving the focus beyond merely managing symptoms to fundamentally altering the disease trajectory. This global scientific effort provides profound hope. The future of Alzheimer's treatment focuses on early intervention and personalized medicine. A new generation of targeted medications and immunotherapies aims to clear amyloid before meaningful cognitive decline occurs. Non-pharmacological interventions, including cognitive training and personalized diet programs, show promising results in delaying symptom progression. Continued investment in neuroscience research brings us closer to breakthroughs that may change the course of this disease. Understanding Alzheimer's disease, from its biological mechanisms to emerging treatments, empowers you to take control of your brain health.